Today's topic: what causes prostate problems? Welcome to International Academy Germanische Heilkunde by Dr. Hamer, MD. My name is John Holletower. At GHK Academy, I'm responsible for representing the original seminar program, according to Dr. Hamer, in the English language. The prostate is glandular tissue. You will find a description in the scientific diagnosis chart in the yellow group, endoderm. We find the corresponding brain relay in the brain stem. The conflict content is an ugly semigenital conflict. Ugly is clear as far as what it means. Semigenital means sexuality resonates, but it is not the core problem. A typical example would be the older man who has no more territorial behavior because he is changing and moving towards being hormonally female. If a younger woman runs away from this older man in favor of a younger man, this can cause the prostate conflict. But it can also be an ugly argument between the older father and the younger daughter, or when the father learns that his son is gay. The more conflicts one studies of prostate patients, the more precise one understands what semigenital means. If you have experienced something like this, and since then you have had problems with your prostate, for example when peeing, there is no reason to panic. After all, it is about a sensible biological special program that helps you to solve the cause of the conflict. I'm going to explain this special program. In the active phase, the prostate tissue increases and produces more secretion, which increases the ejaculation. This is also the biological sense in the conflict active phase. And this is to impress the female. We must learn to understand the whole of medicine from the history of development. The yellow group is the endoderm, with the glandular tissue, together with the associated brainstem, which controls this tissue, and together with the associated conflict potential, eat and reproduce. These programs originate from the great prehistoric times. There was only this ring-shaped worm, which still lived in the primeval sea, from which all life originated. Our ancestors was, so to speak, the fish in the water. And if now this fishman delivers a much bigger sperm cloud than every other, this impresses the female, and she returns to the male, so that he could solve this conflict again. It does not have to be the female that runs away from him. It could also be the 2 or 3 other new females who are impressed by our male and want to join him. He thus can resolve the conflict, and the cell division in the prostate stops immediately. Now the brain switches on the associated microbes, the fungi and the fungal bacteria, and the now no longer cell plus of the prostate becomes tuberculous and cleared again under the swelling. So in the healing phase A, this swelling can compress the urinary tubes so that a catheter will be needed to get rid of the urine. With the inconspicuous crisis, you're cold. That's all it is. The swelling goes down again, and by the end of the healing, all is well again. As with any tuberculous healing phase, the healing proceeds with night sweats, which is always a good sign. Case example. A father studied Germanische Heilkunde for 10 years and attended many seminars with Dr. Hamer. His son worked in a bank branch, which was robbed one day. The robber pointed a gun at the son's chest, and the son suffered a terrible scare-fright conflict. When the son went on vacation 6 months later, he came off the track of the scare-fright conflict, and an edema developed in the involved brain relay, causing corresponding brain symptoms. The young man had brain surgery, and this was the conflict for the prostate cancer in his father. The father thought that if his son has brain surgery, he would not be able to have grandchildren. The ugly component of this was the extreme difference between what should be done to the son, according to his knowledge of Germanische Heilkunde, and what his son allowed conventional medicine to do to him. Biologically seen here, the father stepped in for the son to be able to impregnate the daughter-in-law nevertheless. Pragmatically, this would have kept everything in the family. In Upper Austria, the following happened in a farmer's family, which later became public knowledge. The son of the old farmer was incapable of procreation. However, the old farmer insisted on grandchildren. Now, the old farmer impregnated his daughter-in-law himself, and thus he ensured the continuation of the genetic line. Thus, everything remains in the family. Anyway, our poor patient started to have problems with urination, and he contacted Dr. Hamer. The conflict was quickly found. But what is the solution? I mean, you hardly can force the daughter-in-law to have sex with him for the purpose of therapy until she becomes pregnant and a photo of the fetus can be shown. Despite brain surgery, the son managed to impregnate his wife, and now there was a grandchild. This was the solution for our patient. The very next day, he did not get a drop of urine from his bladder. The healing swelling of the prostate completely squeezed off the urethra. He ran to the urologist. The doctor diagnosed him with a tumor marker of more than 50. He shook his head and inserted the desired catheter. He was walking around with this tube for 14 days when he noticed that the urine already floated out from beside the tube. He had the tube pulled out again, and today he already has 2 grandchildren. This patient is not impotent and not incontinent. This is what I call healing, and not what conventional medicine tries to sell us. So, continue to study Germanische Heilkunde. Tomorrow already you might need this knowledge. If you, dear student, have understand this teaching, then you know why you have one symptom or another. And if you know why, then you also know what to do to get well again. Goodbye, until the next video.
Germanische Heilkunde is considered by those who have understood its underlying principles to be the most significant discovery in known human history. While conventional medicine is based on more than 5,000 hypotheses, Germanische Heilkunde can be proven at any time to be the only medicine that is scientifically verifiable. With Germanische Heilkunde, for the first time in recorded human history, there is a scientifically verifiable medicine for each patient case. More than 30 medical universities have already confirmed this in the past. Still, Dr. Hamer's discoveries have been suppressed and denigrated for over 40 years. Take your health into your own hands and learn Germanische Heilkunde while you are still healthy. For this purpose, the GHK International Academy offers you an extensive program of seminar tutorials from the basics through the organ level to the psychoses. This seminar program will change your relationship with your body and your health once and for all. You will find the direct link to the homepage of the GHK International Academy below the video.